So now we can discuss about dengue fever. Dengue fever is a mosquito-borne illness that occurs in tropical and subtropical areas of the world. Mild dengue fever causes a high flu fever-like symptoms. The severe form of dengue fever, also called as dengue hemorrhagic fever, and can cause serious bleeding, a sudden drop in blood pressure, and death. So now we can discuss about the symptoms of dengue fever. Many people experience no symptoms or symptoms of dengue infection. When symptoms do occur, they may be mistaken for other illness such as the flu and usually begins for 2 to 10 days after you are bitten by an infected mosquito. Dengue fever causes a high fever, that is 104 Fahrenheit, and any of the following symptoms such as headache, muscle, bone or joint pain, nausea, vomiting, pain behind the eyes, swollen glands, rash. Most people recover within a week. In some cases, symptoms worsen and can become life-threatening. This is called as severe dengue, dengue hemorrhagic fever, or dengue shock syndrome. Severe dengue happens when your blood vessel become damaged and leaky, and the number of clot-forming cells, that are the platelets, in your bloodstream drops. This can lead to shock, internal bleeding, organ failure, and even death. Warning signs of severe dengue fever, which is a life-threatening emergency, it can develop quickly. The warning signs usually begins the first day or two after your fever goes away and may include severe stomach pain, persistent vomiting, bleeding from your gums or nose, bleeding in your urine, stools or vomit, bleeding under the skin which might look like bruising, difficulty or rapid breathing, fatigue, irritability, and drowsiness. And now we can see when to see a doctor. Severe dengue fever is a life-threatening medical emergency. Seek immediate medical attention if you have recently visited an area in which dengue fever is known to occur. You have had a fever and you develop any of the warning signs. Warning signs include severe stomach pain, vomiting, difficulty in breathing, or blood in your nose, gums, vomits, or stool. If you have been traveling recently and develop a fever and mild symptoms of dengue fever, call your doctor. What are the causes? Dengue fever is caused by any one of four types of dengue viruses. You can't get dengue fever from being around an infected person. Instead, dengue fever is spread through mosquito bites. The two types of mosquitoes that most often spread the dengue virus are common both in and around human lodging. When a mosquito bites a person infected with a dengue virus, the virus enters the mosquito. Then, when the infected mosquito bites another person, the virus enters that person's bloodstream and causes an infection. After you have recovered from dengue fever, you have long-term immunity to the type of virus that infected you, but not to the other three dengue fever virus types. This means you can be infected again in the future by one of the other three viruses type. Your risk of developing severe dengue fever increases if you get dengue fever a second, third, or fourth time. So now we can see what are the risk factors. If you are living or travel in tropical areas, being in tropical and subtropical areas increases your risk of exposure to the virus that causes dengue fever. Especially high risk areas include Southeast Asia, the Western Pacific Island, Latin America, and Africa. And nextly, you have had dengue fever in the past. Previous infection with a dengue fever virus increases your risk of severe symptoms if you get dengue fever again. So now we can see the complications of dengue fever. Severe dengue fever can cause internal bleeding and organ damage. Blood pressure can drop to dangerous level that cause shock. In some cases, severe dengue fever can lead to death. And women who get dengue fever during their pregnancy period, they may be able to spread the virus to the baby during childbirth. Additionally, babies of women who get dengue fever during pregnancy have a great risk of preterm birth, low birth weight, or fetal distress. Now we can see what are the prevention. First one is vaccine. In areas of the world where dengue fever is common, one dengue fever vaccine, that is dengue is approved for the people of age 9 to 45 who have already had dengue fever at least once. The vaccine is given in 3 doses over the course of 12 months. And nextly, the most important point is to prevent mosquito bite. The Health Organization stresses that the vaccine is not an effective tool on its own to reduce the dengue fever in areas where the illness is common. Preventing mosquito bites and controlling the mosquito population are still the main method for preventing spread of dengue fever. If you live in or travel to an area where dengue fever is common, these tips really help to reduce your risk of mosquito bites. The first one is stay in air conditioner or well screened housing. The mosquito that carry the dengue virus are most active from dawn to dusk, but they can also bite at night. Wear protective clothing. When you go into the mosquito infested areas, wear a long sleeved shirt, long pants, socks, and shoes. Use mosquito repellent. Permethrin can be applied to your clothing, shoes, camping gear, bed netting. You can also buy clothing made with the permethrin already in it. For your skin, use a repellent containing at least a 10% concentration of DEET. And lastly, reduce mosquito habitat. The mosquitoes that carry the dengue virus typically live in and around houses, breeding in standing water that can collect in such a things as used in automobile tires. You can help lower mosquito population by eliminating habitats where they lay their eggs at least once a week. Empty and clean containers that hold standing water, such as planting containers, animal dishes, and flower vases. Keep standing water containers covered between the cleaning. So hope you guys knows about this dengue fever. To get more videos, please like and subscribe and press the bell icon so that if I upload a new videos, you will get notification. Thank you.